years and years of compensation, your brain just perceives that as normal.
Yes.
So you have to unwind that neuromuscular memory per se, right? And then teach them the correct way to walk, which is way more efficient once they learn it.
Yeah. So, I've had patients come back to my clinic and they said, oh, yeah, the physical therapist is showing me how to walk again, heel to toe, right?
Yeah.
Which a lot of people sort of get out of doing, right? This point about they don't even know they're walking abnormally because it gets retrained, right? Like I said, 5-10 years people go with living with arthritis before it gets bad enough that they may have a hip or knee replacement. During that time, they really don't know that they've created a new pattern of walking.
Right.
What's the best way to, a neuromuscular, they've trained themselves to walk differently.
Right.
And it's hard to get, you can't just, I tell people, you've had 10 years to develop this abnormal gait, right? Or this abnormal walking pattern. And in 30 minutes, we're going to change your hip. Right?
That's right.
30 to 40 minutes is what it takes for a hip replacement. You're not going to all of a sudden come back to 100% normal
because
after your surgery.
You're right, because that motor pattern, that movement pattern is, again, interpreted as normal after walking, incorrectly, I should say, for years and years, right? So, obviously walking, it's like when the average person walks, you don't think how you're walking, right?
Nobody does.
It's like a friend of mine once told me, the best example of that is say you take a bath and you dry yourself off. It's not like you think step by step, okay, I got to wipe my back, I got to wipe my foot. You just do it the same pattern day in and day out, right? Without even thinking about it. And walking is the same thing, right? So you're right. If someone has an arthritic hip and it's tight or the leg length changes because they're in varus, right? Their knee is bow-legged, then their body starts to, and their brain starts to interpret that as normal. Right? So all of a sudden you go in 30, 40 minutes later, you put a new joint in, and the body sometimes has a hard time adapting to that.
So me personally, I think physical therapy is important for those reasons. I think it's also important that the patient get contact with a medical specialist, because physical therapy, when we order knee and hip physical therapy, it's usually 3 times a week, right? After surgery, until physical therapist starts to see improvement, then you might cut it down to twice a week, once a week, and then you graduate, so to speak, right?
Especially the knees.
Yeah. So I usually order physical therapy for standard is 6 weeks, but the good, a therapist will tell us if, hey, Mrs., I'm just using an example name, or Mrs. Nakasone needs a little bit more. She's a little bit slower. So, can we extend our therapy? And a good therapist will do that and will send it to us and say, she needs a little bit more time. Because not everybody doesn't recover at the same rate.
Right.
Some guys are really good and maybe they only need 4 weeks and then they're good to go, right? They exercise, they understand the exercises, they can do it on their own, right?
Right.
But other people are obviously slower.
It shocked me though, after hip or knee replacements, you guys get them up that day and walking on it. I don't know why I was shocked by that, but I was shocked that.
Well, I think most of our patients are also shocked by that. They're thinking, wait, you just operated on my knee or my hip or both my knees and both my hips.
And you
want me to get up now, the same day? They think we're crazy, but they don't realize that they can, right? And I should take that back. Depending on the functional capacity of the patient.
True.
They some may not. If I'm operating on an 87-year-old lady,
but for the most part, I was shocked if you're younger and wow. Yeah. Please get them up real quick.
Yeah, I think, we're going to, I would like to interview one of our inpatient therapists to talk about some of the difficulties or the challenges that we see with inpatient therapy, because by the time Chip them, get them there already.
Yeah, how much after the surgery do you send them to the outpatient?
We start within, I would say within 5 days, right, Chip? Generally.
Oh, that's fast.
On, availability of the therapist and patients, right? If they're, say they have surgery and then they get discharged, and then from the time of discharge, maybe Yeah, somewhere, hopefully within the week, right?
Yeah.
They get
Usually.
seen as their first evaluation, and then the therapist will schedule their follow-up appointments with them accordingly. But some of our patients that say had surgery are not quite functional enough to go home. They'll go to a like rehab
Rehab.
hospital, the Pacific, stay there for 7 days,
Yeah.
10 days, depending, until they have the basic safety to just go home. Then they start their outpatient therapy.
Got it.
Yeah.